3, 2, 1. We're up. 3, 2, 1.
All right, well, welcome everybody. My name is Craig Register, and I am an adjunct lecturer at the University of Michigan. And I'm gonna mute my YouTube live. There we go. Thanks for being here. I'm gonna say a few words to welcome you all, and then I'm gonna hand it over to our wonderful collaborators. As I was saying, I work for University of Michigan, one of the 3 partners in this. As you can see behind me, I'm a member of LEO, which is our lecturers union, and I'm proudly putting that back there for the general reasons, but also for the particular one, which is we're negotiating our current contract with the University of Michigan. And so if a student or anybody wants to talk about that outside of the class, or possibly even during the class, who knows, I'd be more than happy to do that. But tonight we're gathered for Detroiters Speak. Pandemic Politics from Lockdown to Liberation. And we have a fabulous lineup. This is the first evening in a 6-part series. And for those of you watching us on YouTube Live, of course, we welcome you as well. And this is what we call our community classroom. And for many years now, U of M, Semester in Detroit, has collaborated with our great friends at Wayne State University in Detroit, from the Detroit Equity Action Lab, the Damon Keith Center for Civil Rights, the Department of African American Studies, and we're going to be hearing from Peter Hammer shortly, who's going to frame the series tonight, and from David Goldberg, another Wayne State faculty member, in future sessions. There's kind of 3 groups I want to welcome. The first is our very important speakers, and we'll hear more about who they are and from them shortly. But this community classroom is built around Detroiters speaking, and speaking with conviction, of course, and with a whole lot to back up their speaking from real world and real life experience. And this is how we built our series from day one, which is trying to bring in Detroiters' voices into the mix of college classrooms and to also welcome the wider world. If it wasn't for the pandemic, we would be having a social experience as well. About a year ago, this class met at the General Baker Institute, which we're going to learn more about also in a moment. In person, we broke bread, we had food together. It's a really important part of what we've always done, and we're going to do it again. We just don't know exactly when. But I hope you'll carry that spirit with you into this evening, albeit over Zoom, and a rich conversation with some wonderful people. You'll see on your screen, some of you, that there's some U of M students and also some Wayne State students. So we welcome them. We hope you'll engage this class and this series through conversation and through chatting, the chat function. And then we also want to welcome, again, I mentioned YouTube Live. We hope that people will spread the word about this. Tonight's the first class. We have 5 more sessions. All of these are being broadcast to YouTube Live. And we'll also have questions and comments from our friends out in the world that will be moderated and by tonight by Peter Hammer. The last thing I want to do, actually I'll put it on the chat later, there's a web page for this class. I'll put it in the YouTube chat in a moment, which is where you can find descriptions for each week, where you can find a reading that we suggest, and also more information about who will be speaking each week. And so thank you all again. Without further ado, I'd like to hand it over to our central and primary community collaborator, the General Baker Institute, and Carolyn Baker.
Thanks, Greg, and thanks to Semester in Detroit for allowing us to participate in this wonderful sessions every semester. I know my dad is smiling. He will love participating in this, and he loved talking to students. And so, yes, I'm with the General Baker Institute, which is named after my late father, General Baker, who was a labor organizer, an activist, and some call international revolutionary here in the city of Detroit. He was a part of the League of Revolutionary Black Workers and also other organizations. We here at the General Baker Institute, we're located in Detroit, inside the old Mays Printing Company. It was the first Black printing company in the city of Detroit, and we are located here and very fortunate to be located in this space, a historical space for a historical person to be named after as well. We participate, our pillars are internationalism, projects of survival, arts and culture, and popular education. And those are the pillars that we're founded on, and that's the work that we try to participate in. And all of those are important in movements. And so we feel that none of those pillars are above the other. They all need to work in conjunction with each other to build stronger movements. And so thank you all for having us, and thank you for the speakers. I'm looking forward to tonight and listening and learning, and the students, and I'm glad to be here in the space with you all. Thank you, everyone.
13 p.m. You'll see footage.
Great. So I want to send my great thanks to Craig and to Carolyn and the General Bakers Institute for playing such a key role in hosting us and keeping us together. Very excited. We talk about pandemic politics from lockdown to liberation, but our session this evening is going to be focusing on this whole question of structural racism and public health, and suggesting that if we start thinking about those two as two sides of the same coin, we can be thinking about a path forward. And ultimately, if we're thinking about moving from lockdown to liberation, it's not just ending a pandemic. Is really thinking about new ways of creating community, new ways of fighting for racial justice, and new ways for fighting for racial equity. And in that framework, there's probably no example of racial injustice or inequity than the water shutoff crisis in Detroit. So I'll be giving a framing presentation to try to think about these issues more broadly, but then we're going to do a really deep drill down into water shutoffs in Detroit. Thinking about them from both a perspective of structural racism, but also from a perspective of public health. If you're doing that, there's no more important organization in the city, and perhaps in the United States, if you want to think about water affordability, than we, the people of Detroit. And their executive director, Monica Lewis-Patrick, is with us tonight. And then she will be introducing members of the Community Research Collaborative, Dr. Nadia Gaber and Dr. Emily Kutel, who are going to show some really innovative work in trying to think about water shutoffs, its relationship to public health, and its impact in terms of the COVID crisis. But one other thing we think about in terms of the Key Center. And at the Key Center, we try to think about Detroit from a global perspective. So our last speaker this evening, before we then open it up for Q&A, and you can put your Q&A questions in the chat function, is the Racial Equity Media Fellow at the Damon J. Keith Center for Civil Rights, Martina Guzman. And Martina will be talking about the relationship between water shutoffs between Detroit and South Africa, and give that global perspective and really show how structural racism and racism in both contexts are providing insights that we see differently when we start to juxtapose some of these crises from a global perspective. So deep breath, right? Some people say I talk too fast, so I'm trying to be conscious in a Zoom world and slow myself down. But I'm going to start the screen sharing function and walk through a PowerPoint that tries to start thinking about this question of structural racism and public health, right, from a global perspective. And if I can get all of my different things to be working as they should, which is great, because now I've got a function that doesn't let me actually see my slideshow unless I bring it down. So we're going to go from the beginning. All right, and I'm going to move all of your lovely faces off to the side. So tonight's session is thinking about structural racism and public health, and imagining how reconceptualizing both of them might lead us to a path forward. And I'm going to remind us something of a tragedy that we're all incredibly familiar with, focusing on Michigan and thinking about the disproportionate impact that the COVID pandemic has had on people of color, but on the African-American community in particular. And I call it the kind of 1441% tragedy. We know that in the state of Michigan that 14% of the population is African-American, and yet we also know that more than 41% of the deaths in the early stages, but the numbers have been pretty robust afterwards, have been African-American, right? And then we have to ask that question, why, right? Why do we see such a dramatic racial disparity arising from the COVID pandemic when we all know that all of our biologies are the same, right? And subject in equal ways to the virus, and yet the structures right? The inequalities in which we live give us tremendous differential sense of vulnerability. All right, and let's kind of sort of start unpack that, some of the standard reasons why African Americans have higher rates. But let's start doing that through a lens of racial equity and racial justice, right? So we know that higher rates of comorbidities, right, asthma, obesity, diabetes, hypertension lead to the differential impact. But that's just a reflection of centuries of health disparities, racial health disparities in the United States, right? We know that you're more likely to be in jobs. You see the problems working from home. So we got some dogs. We'll let them bark for a minute and then they run away. All right. So thanks for the distraction. We know that African Americans and people of color are more likely to be in jobs that are essential, right? And we should remember that fact, that number of essential workers when the pandemic is over. They're the bus drivers, the food service workers, the frontline health workers, right? They're less likely to have white collar jobs that can be moved online, right? So they have to keep working. And when you're working, you're being exposed. And we can start thinking about that in terms of employment disparities and racial employment disparities. African Americans are more reliant upon public transportation and have less access to healthcare. And we can frame that in terms of thinking about racial economic disparities, right? It's more difficult to shelter in space in many urban centers, especially when you're dealing with multifamily and multi-generational families, where you think about the construction of white suburban space. White suburban space was designed for self-isolation, right? It's been self-isolating before the pandemic, and that now becomes a health attribute. And we can think about that in terms of the racialization of space and the spatialization of race, and think about racial geographic disparities. And then you have the reality that for very legitimate reasons, which will be explored later in this series, African Americans have less trust in the health system because they've been abused by the health system. And we can think about that in terms of civil rights disparities, right? So if we start thinking about things differently and frame them in a more accurate perspective, we start to think about the COVID crisis as revealing tremendous sort of depths of racial inequality in the United States. Right? And I put 2016 here as a presentation where I took the following two slides from to say, this is not new, right? COVID is new, right? But racial inequalities is going back centuries in this country and was prevalent before this country was a country. So let's now start thinking about interrelationships, right? And the claim that I made back then and the claim that I'm making this evening is the same, that the changes necessary to address structural racism are similar to the challenges necessary to improve population health and public health, and indeed to make universal health care sustainable in the United States. In that perspective, public health provides a frame that can advance racial equity, and racial equity provides a frame that can advance population health and public health. Right? We have to start thinking, if we look at structural racism, it can function as a social MRI. It can help us diagnose the root causes of the endemic inequalities and the impediments of better health, whether during a pandemic or after a pandemic. At the Keith Center for Civil Rights, we believe that structural racism is our generation's primary civil rights challenge. Right? And if structural racism is the challenge of our generation, then the health sector will play the same role in fighting it than the courts did in the first civil rights challenge. Right? So the healthcare workers, the community health workers, the nurses, if they retool their thinking, are actually frontline civil rights workers. Right? And we have to start building the ethos, the training, the frameworks that start to merge those concepts where people are aware of those interrelationships. And that's where we need the common analysis. If we don't have a new analysis that starts to look at structural racism and public health, then we're going to continue to live in our silos. And sadly, as COVID shows us, we'll continue to die in our silos. Right? But we've got to sort of start reframing our thinking. And this is one of my favorite questions, and it drives my students crazy. Right? What determines the social and economic determinants of health? Right? So what determines the social and economic determinants of health? And this is sort of like a health pyramid, right? It sort of starts to generally say what determines health. And if you ask most people, they'll say, you know, the doctor, the hospital, right? That's a sort of biomedical view of health. And in truth, that leads less to determine your health than a number of other factors. It's actually the least important factor on this pyramid. Although we all recognize that if you're sick, you want to see a doctor, and everybody should have equal access to healthcare and equal access to doctors. If you get brave, you go down one layer further, and you say, well, public health matters, right? Population health matters. And that's true, right? But even combined, that still determines a relatively small percent of your health than the other factors, right? What really determines whether or not you are healthy, right? Not only for a day, but for an entire lifetime, and includes your life expectancy, are these social and economic determinants of health. It's the quality of the housing, right? It's the quality of your education. It's the quality of your jobs. It's public transportation, right? That really determines whether or not you're born healthy, raised healthy, and age in a healthy manner, right? And this is then where my favorite question comes in, right? So what determines, and I'm going to have an American focus here, and Martina is going to take us globally, but I'm going to stay in America. What determines the social and economic determinants of health in America? There you have to have a racial analysis, right? You can't understand what determines housing inequality and income inequality, right? And education inequality if you don't have a theory of structural racism and racism in this country. And if you do have a theory of structural racism and racial inequality, you actually now have the power to start to change the social and economic determinants of health, whereas most people take those as given. And they're not given, right? And if we're fighting racism, then we're also improving health. And that's, again, part of that linkage between structural racism and public health, right? But that means we need new approaches, right? We need new ways of thinking, and that goes into systems thinking and thinking about complex adaptive systems and thinking about deep interconnectivity of issues, where we're often taught to see things as separate. We have to start thinking and understanding the dynamics of structural racism. And I'll give the next slide talking about some definitions to sort of give you some markers and some starting points for that analysis. We have to apply that same systems thinking to healthcare, right? And approach healthcare as a complex adaptive system. And we need new policies, right? So over the summer, a great hullabaloo was raised, and it should have been recognizing racism as a public health emergency. And I firmly believe racism is a public health emergency, right? But there hasn't been developed the analytic context to say, what do you do next, right? Now that you recognize that fact, what do you do next? And there's an off-the-shelf answer to that, right? There's a long developed sort of paradigm of thinking about health in all policies, right? Health in all policies, whether I'm going to be zoning a Burger King or thinking about permitting an extension of the Marathon plant, right? Or thinking about the incinerator, right, before it was closed. I need to think about the health impact of that on the communities that are going to be affected, right? And that would start to operationalize this notion of thinking about racism as a public health emergency. All right, but what do I mean by some of these definitions? Because it's important to get concrete and not think in the abstract about these terms, right? First thing, we talk about spatial structural racism at the Key Center, right? And spatial racism is the hyper-segregation of race, wealth, and opportunity. And the truth is that Detroit and metropolitan Detroit is ground zero for spatial racism, right? I often say that we're the new Selma. And if we're not acting with the same intentionality of being the new Selma of spatial structural racism, we're not doing our job. And we deserve to be judged for not doing our job. What do I mean by structural racism, right? At the Key Center, we define structural racism as the inter-institutional dynamics that produce and reproduce racially disparate outcomes over time, right? The inter-institutional dynamics that produce and reproduce racially disparate outcomes over time, right? And you learn through applications, right? So let's think about that 1441 tragedy that I started this talk with. That is a pronounced racially disparate outcome, right? So what is the inter-institutional dynamics, right? How is the health sector intersecting with a dysfunctional job sector, intersecting with a dysfunctional education sector, right? That are putting people of color on the front lines where white collar judge people are working at home and being safe at home. What gives them differential access to the healthcare system, right? How is the fact that they have to use public transportation and expose themselves on public transportation because there isn't equality in car ownership part of that, right? So that's starting to give you a suggestion of what it means to be thinking about this inter-institutional dynamics, right? And it is dynamic. It produces it and it reproduces it over time. The suggested reading that you'll find on the website is a really profound article that came out in the fall that links redlining in the 1930s, right, to social vulnerability in 2021, right, to the comorbidities of COVID-19, right, which means that racism in the 1930s, right, is directly linked in that production and reproduction of inequality to giving us the differential COVID mortality rates that we see today. So where do we go from here, right? And this is sort of giving Monica et al. The sort of notion that we're getting close to the last slide, right? Where do we go from here? We have to think about merging the objectives of improving public health and confronting structural racism, right? They're two sides of the same coin, and they need to be seen as two sides of the same coin. We have to acknowledge that structural racism is the civil rights challenge of our generation, and that health is the front lines of that battle, right? And if we're thinking about structural racism and public health, we have to start forging a collaborative foundation that's going to create the second civil rights movement, which is going to be targeting improving healthcare for all, right? But doing so by dismantling systems of structural racism. And I'm going to end with a slide of Judge Keith, right, from his biography, Crusader for Justice, because at the Keith Center, what we try to do in a very simple mission is live up to the life and legacy of Judge Keith, but to apply those lessons to the issues that are affecting the city of Detroit today. Right? So thank you for listening, right? You've heard enough of me, although I'll stay around as a moderator, but that's kind of just frame this presentation. I said before that we're using water shutoffs as one of our deep case studies, right? And water shutoffs were a tragedy and a public health crisis before the pandemic, right? Water shutoffs became an even more dramatic a problem and crisis during the pandemic. But at the end of the pandemic, I will tell you one thing I know, and I'm not a doctor, but I can tell you this for certainty: people are still going to need water, right? So we can't imagine the end of the pandemic as ending the need to fight for water affordability. And nobody is a better water warrior, and nobody has taught me more about water policy and water affordability and water strategy than the executive director of We the People of Detroit, Monica Lewis-Patrick. What I'm going to do is turn it over to Monica, and Monica is going to have the privilege of introducing the two other presenters, Nadia Gaber and Emily Kutel, who are part of the Community Research Collaborative. So thank you for listening, and Monica, the floor is yours.
Thank you so much, Peter Hammer, and peace and blessings to everyone. Peter is part of our family here at We the People of Detroit, so it's always just an honor to sort of follow him in what we know is a great analytical mind and always willing to be a servant in the city of Detroit. The other thing that I want to make sure that we're connecting the dots on is that this work is interconnected, as Peter stated. We at We the People of Detroit starts with that very strong word, that very small word of we. And so it has been through collaboration with the Keith Center and Deal. It has also been on the legacy shoulders of work such as Michigan Welfare Rights and the People's Water Board, General Baker. Just cannot say enough about the legacy of General Gordon Baker. He is one of my heroes. I can't go through this work without mentioning his work and the shoulders we stand on. So thank you, Carolyn, for you and the family doing so much to keep that legacy alive and keep us educated on how important it is to understand who General Baker is and the role he's played not only in labor, but that the role that he and your mother have played in terms of the human right to water. And so I just have the dubious honor, I'm not going to talk a whole lot because I have the dubious honor of introducing two of the greatest minds that represent the work of We the People of Detroit's Community Research Collective. They've been a part of conceptualizing it, designing it. They have committed countless hours of their time. They've actually even made personal sacrifices to do this work in collaboration with us. And so we see them as part of that leadership team. And so first, I'll just start by sharing a little bit about Professor Emily Kutel. She is a Detroit-based architectural designer, researcher, and assistant professor of architecture at Lawrence Technical University. Emily is a founding member of We the People of Detroit's Community Research Collective, a collaboration between community activists, academics, designers mapping geographies of austerity in Detroit. She is also the coordinator of the Black Bottom Street View, an immersive representation of a historic Detroit neighborhood destroyed by urban renewal. Her current research investigates Great Lakes water and energy infrastructures and their entanglements with land, life, and systems of power. Emily holds a BS in architecture from the University of Cincinnati and a master's degree in architecture with high distinction and a certificate in museum studies from the University of Michigan. And then we have who we call Dr. Nadia Gaber. She has received her PhD with a joint program in medical anthropology from UCSF and UC Berkeley, and is obtaining her MD at UCSF with support from the National Institute of Health and Medical Scientists Training Program. Her research examines water as a social force through which contemporary biopolitics of race, economy, and environment are being reworked. Aligned with grassroots struggle for safe and affordable water, she is a proud member of We the People of Detroit's Community Research Collective. I present to some, introduce to others, our brain trust, Dr. Nadia Gaber and Professor Emily Kudel. Take it away, ladies.
Oh, it's hard to even want to start. What a lovely, generous introduction. What an excellent framing. I feel you know, what we can do is offer some of what we've learned by working in community and talk about that process as well to give some context into, as Professor Hammer said, the water shutoffs as a preeminent case study before and during the pandemic of spatial and structural inequality. So give me 1 second. I'm going to share some slides. Oops, probably see your own faces. Emily, how does that look?
It looks good. Yep, looks good.
Okay, so we're going to go through some of the research that we have done that resulted in a community publication called Mapping the Water Crisis. And then I'll dig into some of specifically the health research that followed that project. And then I'll let Emily talk specifically about mapping the spatial and racial inequality of COVID-19 and water. And then we'll zoom out and talk broadly about how to think about water health in the pandemic. So Emily, take it away.
So yeah, also just want to thank you all for having us, and it's a real honor to be invited to speak here. And also am kind of intimidated by that extremely generous introduction that Monica gave. So nice to be here with you all. And I also want to thank Peter for that really excellent framing. So we're here to talk about our water affordability crisis, which is also a public health crisis on a tremendous scale, as Peter mentioned earlier. Could you go to the next slide, Nadia? This crisis has major consequences for the safety and the stability of our communities. We're focusing on Detroit today, but Detroit is really just the canary in the coal mine. A recent Michigan State University study predicts that over a third of Americans are at risk of losing water access by 2022. So this is really, I mean, I think an extreme case, and you know that this are a major example, but it's something that really should be of concern to everybody across the country. Next page. In the past 10 years, about 170,000 families have had their water shut off in Detroit. Based on our analysis of the water department's shutoff data between 2010 and 2017, we estimate somewhere between 10 and 40% of the city's population. So between 63,000 and 270,000 people have had the city shut off their water. This practice is not only cruel and inhumane, but it also puts the health of the entire city at risk. So I'm going to give a little broader context about our water system, and then Nadia will talk more in depth about our public health research. So the first thing to understand about Detroit's water system is that it is vast. It is a very large, incredibly extensive regional system, one of the largest water and wastewater systems in the world. And it contains countless lead soldered pipes and lead service lines. Next page. The city of Detroit built, maintained, and operated the regional system for 100 years as the water system expanded to facilitate and subsidize the growth of Detroit's suburbs. For our system's entire existence, it has been the center of a power struggle between the suburbs and the city, fueled by segregation and racism. Next page. Emergency managers catalyzed both the Detroit and Flint water crises. So here you're looking at a timeline, and sorry, it's a little bit blurry. Apologies for that resolution issue. If you want to see any of these maps in more detail, you can also look at the We the People of Detroit website, and we have other versions of these too. So here you're looking at a timeline of water shutoffs from 2010 to 2015, and it's showing the periods of time when the city of Flint and the city of Detroit were under emergency management. So you can see that during the time that both cities were under emergency management was really the time when the large-scale mass water shutoffs really began in the city of Detroit. We always had water shutoffs, and even going back decades, there were people who were fighting water shutoffs and trying to end that practice in the city. But in 2013, right after the emergency manager, Kevin Orr, declared bankruptcy on behalf of the city of Detroit, we see this massive spike in the number of water shutoffs that happen in the city. And the other thing that this timeline shows is the time when the city of Flint was removed from the Detroit water system. And when the city of Flint began drawing water from the Flint River, which resulted in the poisoning of the city of Flint. Sorry, I just lost my spot. And sorry, just catching myself up a little bit here. So the important thing to understand about that move, right, about that coinciding of two emergency managers, both instituting large-scale mass water shutoffs and removing the city of Flint from the system, is that it's a connected story. It's part of the same story. Flint was Detroit's largest wholesale customer in the entire system. Its removal from Detroit's system weakened Detroit's finances and helped justify the transfer of control to the Great Lakes Water Authority, which has majority suburban leadership. And so, yeah, sorry, again, you can't read these slides very well. But on the left side, what you're looking at is a map of the racial demographics of the region of the city of Detroit. So the purple dots are African-American people. The yellow dots are European-American people. And the orange dots are people of other races and ethnicities. And you're seeing outlined the parts, the cities and municipalities in the region who have been placed under control of emergency managers, which essentially have the power to override all local democratic authority. This practice has been used to usurp locally elected governments in majority Black cities across the state of Michigan. On the right side, you see a breakdown of the Board of Water Commissioners, which is in charge of setting rates and running the water department. Above the image on the top, you see the breakdown before the formation of the Great Lakes Water Authority. So here is the way that the water department was run and administered for 100 years. The city of Detroit owned the regional system and sold water at wholesale rates to all of the communities surrounding. There was a majority Detroit board, and that was important because it kept the control of the administration of that infrastructure in the hands of the city of Detroit. When the Great Lakes Water Authority is formed, what you see is a change in the balance of power in the administration of the water authority. So on the board now, we have two representatives from the city of Detroit, one each from the surrounding counties, and one appointed by the state of Michigan. So it's really important to understand the poisoning of the city of Flint in context with these power struggles over control of these vast regional system. In 2016, we worked with researchers from Henry Ford Health Systems to do a pilot study on the relationship between water shutoffs and water-related illnesses. So we were looking specifically at skin and soft tissue diseases, as well as gastrointestinal illnesses. Next slide. Our research showed that people who were diagnosed with water-related illnesses were 1.48 times more likely to live on blocks with water shutoffs. We found that the inverse is also true, that people who live on blocks with water shutoffs were 1.55 times more likely to get a water-related illness. So we see this strong relationship between geography, where people live in the city, where water shutoffs are happening, and these illnesses that people are coming down with. And Nadia, is this your slide?
Yeah, so following that, there was a report that was written by a former Detroit Department of Health official who looked at statewide reporting data of water related illnesses. These are mostly like gastrointestinal illnesses, or like, like you would get food poisoning or water poisoning bugs. And the spikes that you see are threefold increases in the rate of these waterborne diseases in Detroit, following exactly when those spikes on the timeline of water shutoffs occurred. So this gave powerful evidence at the state level that there was these outbreaks of otherwise rare diseases that were creeping up in Detroit, and that correlated with the timing of water shutoffs. So we followed this with more community health research and mobilized more than 40 volunteers to do first a citywide study of water shutoffs all across the city, because some of the background and I think history that's important to talk about here and piggybacks on why health is a frontline is that Detroit became one of the first cities in the country to say, because of financial distress, that public health was no longer an essential city service. And this is part of the politics of austerity, or the kind of shrinking of what government sees as its responsibility, the shrinking of what public services and goods are paid for by public money. And so a lot of health research just wasn't being done. And so it fell on community members to mobilize ourselves and to actually go out and do research ourselves that usually you would expect a public health department to do. So in order to do a survey in the city of Detroit, which is massive, we actually used a disaster health toolkit written by the CDC that's meant for use in after hurricanes, after tornadoes, or after those kinds of natural disasters. And we were able to kind of argue that this was essentially a socioeconomic disaster on that scale, and that people were being exposed to disease, and we needed to take this kind of rapid action like you would in any, quote unquote, natural disaster. And so we randomly selected blocks all across the city of Detroit. We looked in the background as a filter of the prevalence of water shutoffs. So the darker areas are the blocks with higher numbers of water shutoffs. And so as you can see, the yellow dots are where we surveyed. We looked at areas with low rates of water shutoffs, like in Midtown and downtown. We looked at at areas that had high rates of water shutoffs, so that we made sure we got a good sample. And we found a baseline picture of high water shutoffs. We found that people were using bottled water as their primary drinking water source, sometimes even had water turned on, which I think is the issue of trust and trust in government, which is of course part of the Flint water story and a long part of the medical history of racial inequality. And we compared it to this moratorium that was recommended by the county authority health agency. And they said, well, we should protect vulnerable populations in the house, or who are 62 and above, feeding mothers, people dealing with chronic diseases, or otherwise in need of critical medical care. All of these groups should be protected from water shutoff. So they try, well, you know, if as long as you're going to found that more than 80% of residents of households in the city of Detroit would have qualified for this health protection. So you're just talking about a population that's already quite vulnerable. And of course, it goes without saying that everyone needs water and needs clean water to survive. And so this research, I think, pushed back on the special protections argument and pushes for the understanding that water should be available to everyone. We also did a follow-up survey. So one of the things that we heard when we went around the whole city was that people were having lots of mental health symptoms. So a lot of anxiety, people were having nightmares, people were having experiencing stress and depression. And so we went into a community that was hardest hit in the Brightmoor neighborhood, and we did a more thorough survey with 100 participants in a food pantry there run by one of our We the People partners and also a community researcher. And we found that at the time of survey, 5% of households were without water, and 17% had experienced a water shutoff even if they were reconnected, and more than a quarter had been shut off or were currently at risk of being shut off. The average length of time that people stayed without water was 10.5 days. And of note, that contrasted very sharply with what the city was saying in public documents, and what the water department was saying was that most people were reconnected within 24 hours. So for us, the average was 10.5 days. And this goes to the importance of transparency, and back again to the question of public health and data. Like the city was submitting press releases, not studies. And when we did the study, we found that actually people were living for a long time without running water. The average water bill was $371. And like I said, more than a quarter said that they were usually or always stressed about affording their water bills. So when we went to this food pantry and did this study, asking people about their their psychosocial distress, or the ways that mental health problem showed up in their lives, we found a strong and statistically significant relationship between unaffordable water and mental health impacts, which is to say we were able to isolate all of the other factors that may be going on and just specifically look at water insecurity and whether that could be whether the symptoms of distress, anxiety, nightmares that people were experiencing could be attributed to water. And yes, in fact, it was having a really big impact. So just to show you, I think some of, what people told us when we asked them if they thought that if they were drinking water they thought might be unsafe for their health, more than 80% of people in this very low income community said yes, they believed their water was unsafe for their health. About a third said that they were collecting water from an undesirable or dirty source. Again, more than 3/4 worried they wouldn't have enough water to meet their basic needs. People were borrowing and sharing water with friends, neighbors, and relatives. There were household arguments over water. People were, more than half of people were reusing water to do their household tasks. So doing them in an order where the dirtier the water got, the more you're using it to clean. And also this last question, are you worried about the removal of a child from your home due to shutoffs? 3/4 of people were. And so this issue about the fear of child protective services was very serious because it prevents people from seeking help and from seeking government assistance, which I think is often something people feel like is a given. And actually, without running water in the home, people were afraid that would make the home legally unfit for them to keep their children. So I'm going to hand it back over to look at the research that we mobilized as the pandemic was unfolding and in response to COVID-19, and starting with this water audit.
So yeah, this is really very recent research, which we're in the process of publishing right now, or starting to try to publish this research. So this is really new work. And yes, apologies again that you can't read the keys on here. This is a map of the states that instituted water shutoff moratoria when COVID hit. And this is capturing a really particular point in time when we mapped this, which was in June of 2020. So was early on in the process. And so, this was a kind of a rapidly changing picture. So think of this as a kind of snapshot of what was going on in the country at that time. And you can see that there were an incredibly large number of states that recognized that in the midst of the pandemic, it was necessary to stop shutting off water to people, that it was essential for people to have access to water in this context. But also that there was a lot of disagreement, and there was actually a lack of protection in a large part of the country from water shutoffs, including in some states with incredibly large populations of people. And so if you could go to the next slide.
Yeah, I'm going to try to share the whole screen. Sorry, everyone, because the resolution issue is not occurring for me. So give me 1 second.
Oh, cool. Yeah, maybe it's something about just the Zoom connection.
Yeah, I think if you, is that any better?
Oh, yeah. Yeah, that's great. Thanks.
Okay.
Awesome. So yeah, we can go right to the next one. So we're going to look specifically at how COVID played out in Detroit in the kind of early days of the pandemic, when really it was at its most severe in the city of Detroit. So first, we're going to look at who lives in the parts of the city that are most impacted by water shutoffs. And right now, you're looking at 2 maps of shutoffs in this city, and you're seeing it mapped 2 different ways. On the left side, you see the largest cumulative number of shutoffs over the course of 7 years. At the time, we were mapping this time period of 2010 to 2017 because that was the data that we had at the time, and this was really kind of immediate research that we were trying to put out in a really rapid way. We are actually still waiting for data from the water department, which we requested via a FOIA request in April of 2020 for data about what was happening with shutoffs in the city at the time when COVID hit. And so it's been, a really long process of trying to get that data, and we don't have it yet. So what you're seeing instead is a kind of long time period. We're seeing, so the kind of cumulative number over this time period. And really we see these patterns, they don't change too much from year to year. So you can think of this as a pretty accurate kind of predictor for the parts of the city where we would see a lot of shutoffs at the time when COVID hit. We do know from reporting by Bridge Magazine that up to 9,500 homes were potentially shut off at the time when COVID hit. It's an article from February of 2020 that we used for those numbers. And so we know that a lot of people didn't have access to water. And so here you're seeing these outlines, and you'll see these outlines show up in a lot of the maps that follow. So you could go to the next slide. So I said that first we were looking at who lives in the parts of the city that are most heavily impacted by shutoffs. And you see these 2 ways of looking at it, by cumulative number and by rate. So rate corrects for population, so that you're not just looking right at a map of the population of the city, but you're actually looking at how many shutoffs were happening per person in that area. And you can see that they basically correspond, except that the area in the very southwest tip of the city has a really high rate, but a low overall population. So it was important for us to also include that in our analysis and look at that area. So what we see is that the parts of the city that are the most heavily impacted by shutoffs are the same parts of the city with the largest number of households with children. So this is the parts of the city where really the city's children live, and also the largest population of residents over age 65. And you can see that really, especially on the northwest side of the city, there's really quite a lot of older residents in this part of the city, which is also most heavily impacted by shutoffs. Next slide. The next bit of research that we did was to look at how COVID was playing out across the city. And so again, you see COVID cases mapped 2 different ways. On the left, you see the rate. So here we see how many COVID cases were happening per person in each zip code in the city. And what you see is a really strong correspondence with the location of nursing homes in the city. We had very severe outbreaks in nursing homes in Detroit. And so there were a very large number of the cases were occurring inside of those facilities and spreading within those facilities. But for our purposes, we were really trying to understand what effect water shutoffs might have had on the spread of COVID in Detroit. And so really what we were looking at was not cases spreading inside of nursing homes, but cases spreading outside of nursing homes, outside in the neighborhoods, outside of these facilities. And so we were really interested in trying to look at this data in a different way and to understand how many cases were occurring outside of nursing homes and if there was a correspondence with those cases and water shutoffs. And what we found was that there was a strong correspondence. So on the right map, what you see is the total number of cases per zip code. Looking at the data in these two different ways shows you that there were many, many more cases that happened in the northwest side of the city. So in the darkest green area, you see 1,000 cases, 1,042. And then on the sort of near east side of the city, where when you look at rate, that looks like it was the most severely impacted in terms of the number of people, number of COVID cases per person that were spreading. But then when we look on the right side of the map, we see there's actually a much smaller number, 495, so less than half of the cases that were on the northwest side of the city. Okay, so that's an important thing to know, right? So there's a large volume of cases happening in the northwest side of the city. And then we looked at how many of those cases were happening inside of nursing homes. The city released this data about how many cases were spreading in each nursing home. And so we were actually able to pinpoint which zip codes had those cases within them. And what we saw is that a very small percentage of the cases on the northwest side of the city, where we see this strong correspondence with water shutoffs and this strong correspondence with the elderly population in the city, that those cases are mostly spreading outside of nursing homes in the community. And so we're worried about that correspondence because we see that there were likely many, many people in these neighborhoods that did not have access to water at the time when COVID hit. And these are populations which are especially vulnerable to this disease. And we see this strong correlation. So you could go to the next map where you see those two pieces of information overlaid. So here's the areas of the city that are the most impacted by shutoffs, and the areas of the city where we had the largest number of cases spreading outside of nursing homes in the community. So there's two takeaways from this research. The first thing to know is this kind of research doesn't prove that water shutoffs cause an increase in COVID cases. It shows a correlation, which is different from showing causation. So it's important to know that. But it does show that water shutoffs are disproportionately impacting elderly people and families in Detroit. And we can see that the largest COVID outbreak in the city in terms of numbers of cases happened on the west side, right at the center of the shutoffs. So this practice of mass water shutoffs is incredibly dangerous, putting our most vulnerable populations in the city at risk in the middle of a pandemic. And the other thing to understand about this is that COVID affects the entire region. It doesn't just stay in the zip code where it's spreading, right? It affects all of us. And so this should always be understood as a problem that everybody in the entire area should be incredibly concerned about. And I think it's important to make those arguments in spaces where policy about these kinds of practices are being made.
Great. I'm gonna pick up exactly on that thread because we just wanted to end by zooming out and thinking about exactly why it matters, not only to those who are directly impacted, but broadly, like how do we think about water health and inequality? And so this is sort of a busy graphic slide that's just like, let's start on the left side where we're talking about what are the direct ways where water has a relationship to health. So we have first like our routes of exposure through ingestion, inhalation, or dermal absorption. Then you have how do you get exposed? You can drink things, foods contain like even animals, fish are all contain whatever was in the water. You can go swimming, you can take a shower, you can go fishing. What are the hazards that are in water? So you have your viruses, your bacteria, and your pathogens. You have chemical hazards. a huge amount of pollutants and runoffs, more than 70,000 in most US waterways, and only less than 1% of them are tested and regulated. And then you have pharmaceutical byproducts and really anything washed down the kitchen sink. And then backing up from that, the drivers of exposure to all of the chemicals, contaminants, and pathogens that are in water really come from massive industrial production, especially in areas like Michigan, which is largely unregulated. You have climate change related effects. You have agriculture, the increasing use of water and the increasing use of fertilizers to drive agriculture. But less talked about, I think, are these on the right. What are the indirect effects? So you have various routes of exposure that include your social network, your place of work. These are all of those employment inequalities and discriminations that Professor Hammer was talking about. Your means of exposure, include going grocery shopping, talking, communicating with others, right? There's water droplets, there's respiratory droplets, which now we're all increasingly aware of. And then the ability to wash your hands. And this was something that we zoned in on when COVID was unfolding, because of course, people without running water in the home don't have the ability to safely wash their hands. And then you have the indirect hazards. So these are just the kind of social and political dilemmas around insecure housing, around disabilities that are unprotected, around access to healthy foods or living in food deserts, all the ways in which you could make alternate choices in terms of your exposure. And then the more structural drivers of exposure. So disproportionate rates of criminalization, a low unemployment in certain neighborhoods and for certain groups of people, variations in the amount that you're paid, even if you're doing the same job, unequal access for people with disabilities. All of these things drive our exposure to an event like water shutoffs, or broadly to not having access to safe and affordable water. And so I won't go into this too deeply because it was so nicely presented in our framing, but we know that coronavirus cases and deaths were disproportionately high in African-American communities in most states. And it was particularly true, unfortunately, of Michigan. And there were big, this is less so the case now, but as the COVID crisis was unfolding, many states weren't collecting data on racial and ethnic information. And so we couldn't really track disparities in many states. And when we did, I think it was shocking to many, this 14 to 41 divide in terms of who is dying from this disease. And so that has a lot to do with the underlying conditions. So not only are you more likely to catch COVID if you're African American, particularly if you live in the neighborhoods that have been really disinvested from by public services, including basic water access, but also because over your entire life, you've been exposed to different amounts of environmental pollutants and allergens that could lead you to develop asthma, diabetes, and heart disease. And so those underlying conditions that we know make people more susceptible to severe illness or dying from COVID are more prevalent in communities of color. And we see that the gap in COVID death rates also changes by age. It's actually among 35 to 44-year-olds that we see the biggest gap, which I think is a surprise, given that it's really the people who are 65 and older who are at most at risk from dying. But we had a lot of young people who with a disproportionate death rate from COVID. And I think that's a really important area that needs more research. And of course, there's this question, Professor Hammer showed that pyramid, and the tip of that pyramid is healthcare. But of course, if you do get infected, you want to be able to go to a hospital and be treated. And the rates of people living without insurance are much higher in communities of color, and people who may or may not have insurance but refuse to go see a doctor because of their copay or because of the cost of the visit. So healthcare access is also a driving disparity. And then that, I think, is just the tip of the iceberg of this broader economic disparity. So we see major discrepancies in people who are worried about bills on a month-to-month basis, including rent, mortgage, and housing costs. And water is part of what's driving those massive housing costs. You know, not having running water in the house makes it functionally unlivable, but there aren't the same legal protections to utilities access as there often are protections against evictions or foreclosures, for example. And so just one interesting study that came out just last year as the pandemic was going on, they looked on American Indian reservations, which were also devastated by COVID-19, as to what were the drivers of COVID-19. And the two variables that they were able to isolate and say these had significant correlations. One was not having English as a first language, and you can imagine how that makes it really hard to understand how to stay safe. And the second, the biggest driver of COVID-19 infections on the Indian reservations was the lack of indoor plumbing and access to potable water. So again, we know that this is a national issue and that not having access to water will drive COVID cases and deaths. This is just a graph actually of the WHO did a study, and we know the same thing globally. So in areas of the world that didn't have access to water, the COVID case rate was much higher. And just ending, you know, some of the messaging that's coming out, I think it's important to disentangle a narrative that kind of blames people for literally incorporating all of the social inequalities. So when we talk about, for example, higher rates of asthma in the Black community, that is a literal embodiment of political, economic, and social disparities. But then to turn it on its head, you know, our Surgeon General at the time, you know, made this comment about avoiding alcohol, tobacco, and drugs. And I think that that was seen by many as a way of placing individual responsibility on avoiding COVID, when we know that really it's people who have to go to work, who have to use public transportation, all of those social drivers of exposure are more important than thinking about individual people's practices. And then we had this comment from actually a physician and a sitting state senator who said, you know, could it just be that African Americans don't wash their hands as well, or don't like to wear masks? So I think there are still these lingering ideas about, you know, about social blame that we really need to remove from the equation, because the drivers of these disparities are just so much deeper. And so we'll leave you with that. I think hopefully we've given Martina Guzman enough time and to transition into the global impacts. But I just also want to thank you all for listening and for having us.
So I just tremendous appreciation for We the People of Detroit and for the work that Monica's doing and Nadia is doing, and Emily. And I think it's time for a little bit of shaming. Right? This research is not being done by the CDC. This research is not being done by the state of Michigan. This research is not being done by Wayne County. This research is not being done by the city of Detroit. This research is not being done by the University of Michigan School of Public Health or Wayne State, right? This research is being done by We the People of Detroit, right? This research is being done by a community group, right? Because it's responding to community needs. And I want to lift up the quality and depth of this research. And I want us to ask that question, why aren't public officials doing comparable research, right? And why aren't they being informed by this research? And why aren't they lifting this up? And why isn't this in the headlines? And those are some of the questions that the people listening to this program should be taking home with them. But a real just sort of expression of gratitude and appreciation for the years, right? Years of work that you all have been doing to try to lift up this relationship between public health and structural racism. So our next speaker is Martina Guzman, who is the Damon J. Keith Race and Justice Fellow, Media Fellow, and recently has done some amazing work, and we can sort of drop some links, I hope, into the chat as well, so you can see some of the photos and the news coverage. So Martina, take it away. Talk about Detroit and South Africa as it relates to water.
Hi, thank you. Thanks, Peter. Wonderful job, ladies. Incredible work, really. Well, you know, Peter said a couple of things. Is like we like to look at Detroit from a global perspective. And we do that because there are things that happen in Detroit that don't happen anywhere else. And Detroit is often, in my opinion, used as a testing ground to see how far people can go, right? Can we take away their democracy? Can we turn off their water? You know, there's all kinds of things that are pushed to the limit, like tax foreclosures and on about what happens in Detroit and doesn't happen anywhere else. And when I first started reporting on water, I remember thinking to myself, or asking myself the question, where else is this happening? Where else are they turning off water to thousands and thousands of poor people in a city, right? And I had to leave America in order to find something comparable, in order to find where else this was happening. And sort of my research took me to South Africa, right? And the parallels were uncanny, you know, both Johannesburg and Detroit have these significantly high, more than 80% Black populations, right? Both cities suffer from catastrophic segregation. Both cities are run in the Black community mostly by single Black women. And they just kept going, right? And so I felt that I had to really look at what was happening. I had to really investigate these two places and to find out, you know, what they had in common in terms of water shutoffs. And what I found was that, you know, people were making decisions and doing things that they can only get away with in sort of poor Black cities, right? And not that all of Detroit is poor, and not that all of Johannesburg is poor, but I think you know where I'm going, right? And there is a role when we talk about the emergency manager that when Emily was speaking earlier, that we need to consider, right? The role of the banks in all of this. And the role of the banks are really important because the role of the banks in Detroit, right, where they were putting pressure on the state, you know, to try and get their money back from the city of Detroit is what ultimately began to push the governor to push for an emergency manager. And that emergency manager suspended democracy, right? There was no democratically elected officials in power anymore. So they could basically do what they want, which is when all of the water, the shutoffs began to happen and, you know, the authority changed from the city of Detroit over to the suburbs, you know, the control of the water. In South Africa, it was the world banks that began to pressure South Africa with neoliberal policies, right? That began to push them to create these sort of like public-private partnerships with corporations, you know, and using language that we all know, such as, you know, you'll be more organized or you're not organized enough. You know, this kind of language that is used often to when people want to come in and sort of do what they want in a city or in an organization. And it pushed the private sector of this private-public partnership, pushed the leaders in Johannesburg to create a new water system, right? And they, in order to create this new water system, they were going to raise the prices of water, right? Raising the prices of water on the poor people. And they were going to create a system because they didn't trust Black people to pay for water in the traditional sense. So they created water meters. And every single Black household, every household got this meter. But if you were Black, you have to pay for your water before you use it. Now just think about that for a second, right? So we get a bill, a water bill, and we pay it after we realize how much water we've spent, right? So imagine completely taking that around and saying, no, if you want water, you have to pay for it before you get it, right? So if you have no money and you're poor, or you know that you're not gonna have money for several weeks, you can't go and pay for it like with this little coin, you know, you go to a certain place and, you know, they put this credit on this little contraption that goes into the water meter. It says how much you've paid. Then only once it's put into the water meter, it tells the meter how much water you paid for. And then it allows you to have water, right? But there are tragic, horrifying incidences of things that had happened in South Africa because of these water meters. Like there was a really well-known case that went all the way to the South African Supreme Court about a neighborhood in Soweto where a house had caught on fire and they began to pump the water to try and stop the fire. But because they only had a limited amount of credit, the water turned off and burned all of their belongings and burned subsequent other houses around them, right? So these tragic, horrifying stories, again, that would only happen, you know, in a place where people think that they can get away with something. And so I began to sort of interview these sort of global experts about the story. And one of the people I interviewed was a professor in the United Kingdom who studies urban geography. And he said to me, you know, the reason that this happens, the reason that this was going on was because you had this horrifying segregation in both places. That in South Africa, all of the Black people were pushed into Soweto and into this township, right? And in Detroit, everybody left the city and concentrated all of the Black people within the city of Detroit, right? And so what they were doing, it's a kind of segregating communities, it's a kind of redlining, and you do that when you have a white supremacist worldview. When you try to separate them from you, that is white supremacist, you know, thinking and turning into action, which is what happened in both cities. And when Peter talks about spatial racism, this is the quintessential example, right, of spatial racism, and segregating people in order to begin to do things. And when you separate people, just like in Johannesburg and in Detroit, you take the opportunity, you take all the people who own the businesses, you take the financial institutions, you take all of the things that help create and lift, or I should say, lift people up, we're gone. Same thing in both cities. And you know, there was this culture in both places when I interviewed people that sort of pathologized the poor, you know, that dehumanized them for a culture of non-payment. That if you couldn't pay, that it was your fault, right? Which again is also a very racist perspective and point of view. And in South Africa, you know, they would say if you had to get water, in South Africa, that you have the right to water, unlike other places. You know, there is in their constitution, you have the right to water. They would say that if you can't afford it, you know, there's all these spigots of water that exist within places where women go daily and fill up these buckets of water and then go back to their home and try to use that bucket of water to cook, to wash clothes, to wash their children, you know, for basic hygiene. And I remember this same scenario, this same scene in Detroit, where I had seen countless women going to their neighbors, going to their cousins, going to all these different places, to friends' houses, to churches, to fill up buckets and gallons of water so that they could also bathe their children, so that they could also fill up bathtubs and use the water to cook. And it was no different, right? It was happening in both places in the exact same way. And so, you know, what confounded all of this to me over and over and over again was this racist white supremacist worldview that sort of has its hands in every aspect of it, but also the treatment and the pathologizing of Black people. And I'll give you a quick example. In Detroit, during the water shutoffs, this was a journalist, you know, who went on national television. You can look up the video, right? A guy named Hank Winchester from Channel 4 goes on national television with a Detroit activist to talk about the water shutoffs. And he says on national television that if Black women didn't, they needed to stop buying purses, you know, that if they did that, then they wouldn't get their water turned off. And the fact that he could say this on national television, right? I mean, gives you insight into someone's mind, right? That to me, that is a classically racist comment, you know, that you would blame poor people and accuse them, you know, nothing about them of buying purses. And one of the things we did at the Keats Center, we did this analysis, we did this data study, right? Where we pulled 250 articles of the water shutoffs during the height of the water shutoff period in like 2014, 2015, 2016, 250 articles. And 80%, more than 80% of the articles had a blame slant to them, right? That the articles had this kind of siding with the water shutoffs as people, that people should pay their bills, that it was their own fault. and it had all of these narratives of blame, right? And that was astonishing, you know, that as a journalist to find that, right? That journalists who sit in newsrooms are writing from this perspective, right? This sort of, to me, what is a classic racist framework. You know, without writing about the levels of poverty that Detroit were in, that Detroit was one of the most, if not the most hit city of the Great Recession, and that it was still reeling, barely recovering, right? That there was, without looking into the jobless rate and the education rate and all of the things that make people have either better jobs or higher income, right, were sort of eliminated and not talked about in these stories. So, you know, going to Africa was one of those sort of research projects that I had done before, right? That I had to look at Detroit from another country, because that's really the only way that you can look at it. There's no other city in America that you can compare Detroit to. It's massive manufacturing contributions. You know, it's iconic status. It was considered the arsenal of democracy, and the list goes on and on. You can go literally in the middle of South America and say, I'm from Detroit, and they will say two things. They will say Motown or cars. If I went to Latin America and I said Cleveland, they would have no idea. That kind of iconic status in a city, right? You have to sort of take it and compare it to another iconic city. And it, for me, it happened twice. It happened with the comparison to South Africa, and then it happened another time with a series called the Detroit-Berlin Connection, right? Because we had to leave the country in order to look at post-industrial cities. That where else in the world could a city have the kind of rise and fall and catastrophic fall that Detroit had that was once this manufacturing industrial might, right? And that city took me to Germany. And in Europe and in the you know, that part of the world, Berlin was the other example. So I did this very long series comparing the two. And you know, what astonishes me is that local media still continues to sort of frame these issues in a very narrow perspective, right? Instead of looking at it not just from, you know, something that has to do with race and poverty, you know, and health, and you know, all of the kinds of things that you look at as markers for cities. They still look at it as a perspective of like, this is happening to you and it's your fault, right? And I have a very challenging time with the kind of way that things are portrayed in the media in Detroit. So I just continue to do the work, you know, that when we talk about spatial racism, when we talk about health disparities, when we talk about sort of land and tax foreclosures, because this is also a land issue, right? People that don't have their water, if you didn't pay your water bill, right, it would go on to your taxes. And if you could not pay your taxes, they would foreclose your house. So there was all of these things wrapped into the water shutoffs that went far and beyond, you know, someone's inability to pay. And now we have a foreclosure crisis. And even though those things are not linked anymore, they were linked. And so again, it's about land. It's about the suspension of democracy. It is about pathologizing the culture of blame on African Americans and in South Africa and Black people. And it's about a testing ground, right? What can we do in Detroit? How far can we push it? How many houses can we take? How many how many water shutoffs can we do? And it just continues to go. So if this is not happening in another city in America, then you have to go outside, right? You have to frame Detroit in this global perspective. Yeah, and I think I'll close, unless anyone has any questions.
Well, thank you, Martina. It was the time to transition into questions. So this is perfect. So I'd say, remind people, if you have questions, put them in the chat. We have a couple already. But I would like to just sort of offer an invitation to Monica if she has any kind of thoughts to be sharing, having listened to this, or before we move to questions themselves.
No, I'd love to hear the questions and be able to respond to those. Thank you.
Your volume's not not up.
My apologies. I said I would prefer to defer to the questions so we
Okay.
can get more of those
Excellent.
responded to. Thank you.
All right. So the first question we have says, I would be curious to know what We the People sees as the gold standard in terms of water policy that the city of Detroit could enact to address these issues. And that might be best addressed to you, Monica.
Well, for us, is the gold standard is actually the policy that the people of Detroit stands on the shoulders of. The policy that was created in 2005 by Michigan Welfare Rights and People's Water Board, a coalition of groups. We believe that the tenets of that policy is the same tenets that were used to establish the Philadelphia water affordability policy, that have been used to provide guidance to the Baltimore water affordability policy, and that is also being lifted in many communities across the nation, such as Chicago right now is being considered. So many times people don't give credit to the fact that the root of the thing is the thing. So the root of water affordability was birthed here in the city of Detroit. It was legislative champions like the great late Mary Ann Mahaffey, who was a social worker at Wayne State University, and who brought those values and that advocacy into the legislative sphere. It was the civil rights long work of the Honorable Councilwoman Joanne Watson, who had headed up, the first woman to head up the largest chapter of the NAACP in the country, and also was known as a figure to take on government before she was a part of government. And so those women, along with the leadership of Michigan Welfare Rights and People's Water Board, and some of the people that now have transitioned, like Charity Hicks, they were very focused on utilizing the framework of the human right to water, also using their organizing skills and abilities to leverage not only how water intersects around the issues of inequities and injustices and how families were being separated, children from parents, but then it was also connecting it to the labor movement. You'll find that there were many organized labor elements of local uh, elements of the city labor, uh, of the plumbers unions and others that joined us in that struggle. You'll also find that Carolyn didn't talk a whole lot about this, but her father and her mother's work connected the human right to water to also organize labor. And so it's been all of that collective work. As Martina talked about, it was in 2014 when we were in New York, um, actually making an appeal for the human right to water, that we met representatives from Colombia. And Charity Hicks had made her transition. And when we just said Charity's name, the gentleman began to express how emotionally moved he was by the fact that Charity had transitioned, but that they stood in solidarity with the people of Detroit around water justice and water restoration. The same thing happened with the Arab Spring and in Ireland. We heard from mothers all around the globe standing in solidarity with the mothers of Detroit and Flint around water issues of toxicity and water disparity. And so it truly has been a global struggle when you sort of look at the issue. But I believe that our power has really been around the fact that those women have been unwavering in their position that we will not rest until we usher in the human right to water. And that we believe, as goes Detroit, so goes Michigan, and so will go the nation. And so I'm hoping that all of you will join me in some of the things that I put in the chat to sign on to the water pledge. There are 11 points to that pledge. We believe that it's based in community values and human rights values. It will help us stay in contact with you. It will help you be plugged in to not only policy recommendations, but the research that's happening. I'm hoping to deputize some of you so that you will come out with us in March and April and May. We're going to be testing water in the city of Detroit, looking at water quality issues. We don't believe in We the People of Detroit that we just give you some information and some news that you can use. We need your hands, your feet, and we need you activated. I don't like scholarship for just scholarship. I like it to make you do something, to create some kind of systemic change. So Peter, I'll stop there because I'll go on and on about let's have church on why we all ought to do something about getting the water on, but I'll stop there.
I'll go to church any day with you, Monica. But we also need to kind of land the plane. I will say there's a couple of things that were in the chat room, but just kind of raise them up so people are aware of that. There is an effort to put water affordability in the charter, right? So if you want about sort of a serious policy alternative you can do, that's an alternative. There's a wonderful fight going on about the Detroiters' Bill of Rights, right? Again, something of international significance, showing the leadership of Detroit, the innovation that's going on in Detroit. And I want to lift up the sort of water testing that you were alluding to is really one of the next chapters of We the People and the research collaborative in going forward when the city is not testing, right? So the city's not testing, the state's not testing. And so We the People is going to mount an effort to actually test the water in the city and look at a wide variety of other health issues. Craig, I know that you want to set things up for next week, right? So I'll sort of transition in and let you take the stage
Sure.
and let everybody know what's going to be taking on next week and in coming weeks.
Absolutely. Thank you
Craig,
again.
quickly, can I just say two things? I should have mentioned this. In the chat, I put the article that just came out in Slate comparing Detroit to South Africa, if you want to read it. It's sort of extensive and it really gives details. It's the entire story from the perspective of two women. And also I put the interview with Hank Winchester from Channel 4 doing a national interview where he blames women. That's all.
Great. Thank you again, everybody, for this phenomenal kickoff to the series. This was a lot of really important stuff to lay the groundwork for the series. We're going to be back next week, and we're going to be back for 5 more Wednesdays. Next week is our next session, and we're going to share more information on our website. The title for next week is Racism and Medicine: A History. And so we're going to go back a little bit further back before we go forward, which is how this series always ends up going to the present, as you already heard from Monica and others, of ways that you can be activated and engaged in the work that's happening, not just listening to it, but actually engaging with it. And so next week we'll be back at 7. I hope folks come back. I hope you spread the word to people. Those of you watching on YouTube, please keep spreading the word. We'd love to build the audience. Tonight's session was recorded again, just the speakers and the presentations. So that'll be available to share with friends. But we're really grateful for everybody's important work and for helping us kick off the series. And look forward to seeing you all again next week at 7 o'clock. Thank you so much for being here with us.